Good afternoon, everyone. In the interest of time, we'll make a start. I know people are still coming in, so you're under no rush to come in, but we'll just get going to give Jeroen the longest possible time. So my name is Niamh, and I am delighted to welcome you to this afternoon's plenary session. Just a little bit of housekeeping that you're probably sick of hearing by now, but just in case you took a break this morning and weren't in this morning's talks. So we would just ask you, if you need the bathroom or the toilet during the session, if you can step out of Shelburne Hall rather than using the bathrooms in here, because it does create a little bit of background noise. Equally, we know yesterday that the lights were quite challenging for some individuals, so we have turned down the lights in this room, and we hope that's more comfortable for you, but please do let us know if we can assist with any sensory adjustments within the room, and we'll be happy to support. So we just have a few more people coming in now, and if as we come in, we can just be mindful that the session has started. Just the last piece of housekeeping would be when Jeroen is finished speaking, we'll move directly into questions. I'm aware that some people will be keen for a movement or a comfort break by that point, but just as much as possible for you to be quiet when exiting the room, just so that we can hear the questions and Jeroen is able to best hear the question to answer the question. So I am delighted to introduce our next speaker, which is Jeroen Dewinter. Jeroen will be presenting on exploring the sexual health and well-being of autistic people from here onwards. And I asked Jeroen, was there anything he wanted me to mention? And the only thing was to say good luck. So I'm sure we can all wish him the best of luck for his talk, and I'm delighted to hand you over to Jeroen. Thank you so much.
Good afternoon, and thank you to Autism Europe and As I Am for inviting me today. It is really an honor to be on this stage. Thank you for being here after your lunch. I do my very best to talk you through the dip after lunch. Maybe a quick note, you will see me on those big screens and you will see me trembling. That's partly because I'm a little bit nervous from this perspective. You're quite impressive. But also because I have an essential tremor, I tremble, that's what I do, so don't worry. Maybe another note is that I am still very happy that there was no warning sign behind this talk, that I would say shocking things or use explicit language. I will use explicit language because I think that helps to make things clear. But I think sexuality is a part of our lives, of everyone in this room, whether or not you're sexual active. I will go into that later on. I do have to warn you that I will show some statistical graphs. I'm sorry for that, but you're warned now. So, 20 years ago, I worked in a forensic adolescent psychiatric ward with young people who were referred to us because of their offending behaviors and their psychiatric diagnosis. And there I met several boys, young people and their families who were referred to us because of their sexual behaviors. And we learned rapidly that we did have to do other things, or we had to adapt our approach in the assessment, the risk assessment, and the treatment of those kids. And at that time, when we were looking for cues in literature, there was hardly any research on this topic that could help us. So we reached out, we talked to a lot of people and experts, but what was missing at that time was the voice of the experience of autistic young people and autistic adults. So I was really thankful that I was allowed to start research on this topic about 15 years ago, and that I was able to in my way, and I hope I did well, give voice to the experience of autistic young people and adults. I think that over the past 15 years, we made a huge progress. There's a lot of research on sexuality, gender-related issues, and when you looked at the poster sessions this afternoon, you saw a lot of really interesting studies presented, and also later this afternoon, there will be, I think, another 2 sessions on gender and sexuality with a lot of interesting research, so I think we're going the good way. However, I think that a lot of the research we have now gives us an idea about the experience of autistic people and the needs, but I think there is a long way to go, or another way to go, to learn more about how we can support the well-being and the sexual well-being of autistic people. So, I want to make some additional points before I dive into all those data. As a clinician and as a researcher, I wanted to understand the experiences of autistic adolescents and adults. And I had a lot of discussions with my supervisors at that time about the kind of research I had to do. We did a lot of quantitative studies, we did some surveys, but I had the impression that that was not enough, and so I argued for being allowed to do qualitative study, and luckily I was allowed to. And I did some qualitative studies later on, but recently I had a huge discussion with some autistic people that I really value and I like to collaborate with about a quantitative study we did recently, and I will present some of the preliminary results of that study, because she and other people felt that the way that I used those surveys wouldn't help to give insight in autistic experiences. I do think a combination of qualitative and quantitative studies are necessary and will help, and I hope you will agree with me at the end of this session. Another point is that I really had to learn myself to not only look at the experiences of people, but also look at the broader context of experiences. And that has been stressed over the past few days by a lot of the very inspiring colleagues who talked before me. I think the historical, the political, the legal and social context where we are living in and developing in is important and is impacting our behaviors and our experiences. So I will try to, in this talk, to offer a framework to think about sexual well-being and autism, some numbers, insights and recommendations, and then I will wrap it up. A lot of people helped me over the past 15 years and are still doing that to learn and think about autism, sexuality, gender identity. For most autistic people, advocating for better research and support, and of course, my colleagues, supervisors, critical reviewers, and audiences like you. I am sure that I can learn more and that I will make mistakes, that I will miss out important things. So I hope you will bear with me today, that you will be critical and kind and help me to learn. So if I miss something, if you feel that I should think in it or should take other issues into account, please let me know afterwards. Okay, what I will talk about this afternoon is first, very briefly about well-being, rights and justice. That's the theme of the Congress, so let's start there. Then set the scene and look at societal views on sexuality and autism. Then we dive into those graphs and numbers, and we have a look at what autistic people report about their romantic and sexual interests and experiences. make a step to recommendations to promote well-being, have a look at possible future research, and then we wrap it all up. Okay. The theme for the last 2 days was, of course, quality of life and well-being, but what is a good life for autistic people? We already heard different perspectives on what this could mean, and different ways of thinking about well-being have been described in the literature and over the past few days. I will not answer the question. I'm not in a position to define what a good life for autistic people is, but I want to briefly present the capability approach as a possible framework to think about well-being, because I think that can be a helpful framework in this relating to this theme. A lot of other colleagues in this field have written about it. Liz Pellicano wrote some really interesting articles about this. Ingrid Robijns from the Netherlands wrote a really interesting piece about it. So I highly recommend to read those papers or their papers if you want to learn more. I think it's important to start with a clear framework to have a kind of basis to think well-being and to think about well-being, and I'm going to try to talk you through in a nutshell. So, the capability approach is about capabilities and functionings, and was developed in origin by Amartya Sen, and he is an economist and a political scientist or political philosopher who developed this framework to think about well-being and social justice in a real global macroeconomic perspective. And this approach has been adapted and adopted and further developed by Martin Nussbaum, who is another really famous philosopher, of course, and by a growing number of thinkers in a variety of fields. And although it was developed as a kind of macroeconomic framework, there are calls to try to use it on a more micro level or meso level and that's what we are trying ourselves at the moment, to see if we can use it to discuss with autistic young people what is important to them in terms of capabilities and functionings, and I'm going to explain that in a minute, and what can help or hinder them to achieve or to realize capabilities and functionings. So capabilities and functionings are about what people value to be or do. And the capabilities, or if you look at capabilities, then we focus on are people based on their own resources or their own individual capabilities combined with their environment, the social, environmental context around them, in the fit between those aspects, are they able to be what they want to be and to do what they want to do? And can we organize the world in such a way that as many people as possible have access to the capabilities they value? Capabilities don't mean, or when I refer to capabilities, then or to capabilities and functionings, then are capabilities the things that we can achieve or that we value, but all people have the freedom to choose which of those capabilities they want to realize in their lives, and those things we realize in our lives we call functionings, or the people who develop the framework call functionings. I think this can help us to think about sexuality and sexual well-being, because I don't think we should discuss what people have to do on a sexual, when relating to sexuality, but I do think that we as a society should enable people to, if they want, realize their sexuality in a way that fits them. let me stop there. I just want to briefly show you some of the people who are working or with whom I'm collaborating on the different projects. So Jan Meerman is working hard to finish his PhD on applying the capability approach in setting up discussions with autistic young people and their networks on how, which beings and doings they value and what can help and hinder them to realize them, and how people can support them to realize that. So let's go one step further. We started from a good life. Today we are going, or I have the honor to talk about a good sex life. And what is a good sex life for autistic people? I'm not going to answer that as well, but I thought it would be helpful to show you this visualization that was released last week for the World Day of Sexual Health, which was of it as a central theme, sexual justice. And sexual justice exists when all people have the power and the resources to make healthy decisions about their bodies, sexuality and reproduction. And it means building a world where everyone can experience sexual health, rights and pleasure, free from discrimination, violence and barriers. And I liked that they used can, because I think then we're back at capabilities. We organize the world that everyone, or as many as possible people, can achieve this if they want. I promised that I would start by setting the scene, and I think we should start then by some societal views on sexuality and autism. And over the past few days, a lot of the other speakers have stressed the importance of societal views and shifts in societal views on autism and on the impact of societal views on the well-being of autistic people by stigmatization and exclusion and discrimination. But also we hear some really interesting talks about possible shifts in frameworks that could help to improve the well-being of autistic people. When we focus on sexuality, then we have another layer of normativity and another layer of societal views. And if you start with sexuality, then of course we see throughout the history and the longer history lots of different approaches and views on sexuality. But even if you look at recent history, then you see in the past few decades a shift from a focus on risks and the prevention of, for example, youth pregnancies and STIs and all horrible things that could happen when people have sex, to sexual rights and a sex-positive approach in the last in the last few years. These changing views are, of course, not kind of global. We still see large differences between regions, countries, and communities within countries, illustrated, for example, by the tension between abstinence-only approaches in sexuality education versus looking at sexuality as a normative part of our development, a focus on risks versus a focus on pleasure, a focus on heteronormativity. You marry someone of the opposite sex, you buy a house and a dog and a tree, and then after you're married and you have the dog and the tree, you have sex in one or two positions on Wednesday and Saturday, and diversity in the sexual, in how we deal with our sexuality. I think at this moment, a lot of people in the Western world will start from the definition that the World Health Organization developed and discussed about on sexual health. And what I like is that they tried to combine the focus on the abstinence of risks and the abstinence of violence and discrimination, combined with a focus on pleasure and rights and safety. So that's about sexuality. But when we combine sexuality with disability or with people living with a disability, then we see another layer of complexity. Because sexuality in general is sometimes, still today, a kind of sensitive issue, but when we talk about sexuality of people living with disabilities, that's often, or still often, an even more sensitive issue. And also there we see a shift from the denial of sexual expression with horrible things as forced sterilization and silencing and protection to seeing sexuality as something that might be optional for some people, to very normative approaches of sexuality, which we refer to as sexual disableism or ableism, as fixed views on on how we should deal with our sexuality. And over the past year, also there, a growing attention to the experience of people living with disabilities and more attention to those experiences. And recently, I think there is a growing awareness that also people living with disabilities are sexual beings, and how we can make sure that their rights and their citizenships relating to sexuality are guaranteed. But, and that's something we heard regularly the past days, it's not because we have regulations and laws and legal frameworks that the daily lives, or that those regulations and frameworks are realized in daily lives. And as this quote says, the gap between legislation and people's lived experience still remain enormous when we focus on sexualities and disability. My last step is, of course, how is this for autistic people? And I often use this quote. It's from an article in the Journal of Autism and Developmental Disorders from in the early 80s. It's a discussion or a paper about the discussion between parents and caregivers and professionals about should we talk about sexuality or not. And one of the quotes in this article was that sex is not for the majority of autistic people, and that relates to the asexuality discourse that I just referred to in the general discourse on disability and sexuality. And I think we see a kind of similar shift when it relates to views on sexuality and autism over the past few decades, from an asexuality discourse. And asexuality is not the same as asexuality as an identity, but more about seeing people as not sexual. If we don't talk about sexuality, people won't be interested in sexuality. So don't let us wake up sleeping dogs and just be silent about sexuality. Then we don't make the world even more complicated than it is already. And then later on, a kind of shift to more focus on deficits and vulnerability. We should protect more often girls, and we should be aware of the sexuality and the sexual behaviors of boys. And also, when we look at the literature on autism and sexuality, we see over the past few years, luckily, more attention to the narratives and experiences of autistic people, and we hear more about autistic sexualities. And that's what I want to talk to you today. Okay. What do people with autism say about their sexuality and their sexual experiences? I'm going to show you some graphs, as I promised, and they are based on the first results and preliminary analysis of data we were able to collect in collaboration with the Netherlands Autism Register, with Sander Begeer and Anke Schere as colleagues, and Rutgers, that's the Expertise Center on Sexuality in the Netherlands. Rutgers monitors the sexual health of the general population in the Netherlands on a regular basis, and we were able to use their survey in the Netherlands Autism Register so that we can show you, or we can get some insight in the sexual experiences of a large group of autistic people. And that's, of course, as I said before, just one way to look at sexuality. It just learns us about something about how many people do some things and how many don't. And that's only one way to understand sexuality. We should combine that with qualitative research so that we can learn more about how people do experience those things. But I think the combination of both is really interesting. So this is probably the most recycled slide ever. It's based on the results from my PhD study, but I then decided that I would keep on using it until an audience would predict these results in an almost correct way. I couldn't resist this opportunity to try this out with an audience as big as this one, so you are invited to see if it's the last time that I use this slide. What we did was we also used the survey of the Monitor on Sexual Health used by Rutgers in the Netherlands, and I can show you this data. They survey a large group of adolescents or children and adolescents between the age of 12 and 25 on their sexual experience, and I just showed you the frequencies or the proportions of adolescent boys in the general population in the Netherlands who report experience with relationships, so almost all, with masturbation and having an orgasm. That's also the majority, almost 19%, at the age between 15 and 18. And then with some partnered sexual experiences. And what we see is that the majority of kids in the Western world first have some less intimate partnered experience. They start with kissing, cuddling, giving a hand job, and then you see that lower proportions of boys at that age have more intimate partnered experience. We sent this survey out to 50 adolescent boys with autism or autistic boys, just to see how they would respond. And at that time, we hadn't hardly any other studies with autistic young people and autistic adults where they self-reported about their experience. And we mainly had studies based on parent report or report by professionals, and all those studies indicated that autistic kids and young people had less experience, so that was our hypothesis. So I'm going to show you the same graph for the autistic people in, like, let's say 2 minutes, but I just wanted to see how you think these kids answered. So who of you thinks that less adolescents or less of the autistic boys will report solo and partnered sexual experiences? Can you raise your hands? Okay. Oh, okay. Again, of course. My question was, do you think that less autistic boys compared to boys in the general population will report solo and partnered sexual experience? If so, raise your hand. Okay, that was a better question. Thank you. Who of you thinks that these proportions will be comparable? That the same number of boys, autistic boys and boys in the general population? Okay, my slide is endangered. And who of you thinks that more autistic boys will report solo and partnered sexual experiences? Okay, oh, nice. We're going in the right way. This is what we found. There is no difference found when we compare the sexual experience, solo and partnered, of autistic boys compared to boys in the general population. These were all boys. These were boys living in different kinds of situations, all with IQs or scoring on IQ tests above 70. But it gives an idea. We also questioned or surveyed their parents and asked whether they thought their boys had experience, and then we found this. And that explains a lot about the results we had at that time. So parents are luckily not aware about their, luckily, I'm not sure, but I didn't my parents either the first time when I masturbated, and I also didn't discuss that after breakfast, that I had an orgasm. I didn't do it in public, because then other people had been aware about my solo behaviors. So I think these are, if we question or survey parents in a general population and we compare those results with a self-report, we find similar results. Just one step further, when youngsters grow up, they get more experience, especially with parents, sorry. With partnered sexual behaviors. Oh, this will follow me. But so the blue line, you see, the line below. The line below is the experience reported by the kids at age 15 to 18, and we followed them up 2 years later, and then you see that they report more partnered sexual behaviors. We did the same with the autistic boys, and at that time we assumed or hypothesized that we would find no difference between the experience of the autistic boys and the boys in the general population, but we did find that the young boys who had sexual experience or partnered sexual experience at younger age just proceeded as their peers in the general population, so they gained experience with more intimate partnered behaviors, and some of the kids who only had solo sexual experiences didn't make the step to partnered sexual experience. Some of them did, more compared to the general population didn't. I just wanted to show you this, and then I explain you why. Here you can see the mean age on which all these boys in the general population gained that experience. This is the mean age of the autistic boys. 2 years later, we see this and the autistic boys at the same age. I think this, in my opinion, just makes clear that a lot of autistic boys, and I will talk about girls and trans and gender diverse people in a sec, but this shows us that the majority of the autistic young people gains experience at a comparable age as their peers in the general population, and that makes clear that we should provide comprehensive sexuality education to these kids before they gain experience. The new numbers I can show you give us some insight in the sexual experience of a large group of adults in the Netherlands, or autistic adults in the Netherlands, and we can compare that to the experience and the well-being reported by adults in the general population. And I will show you some numbers based on Donar and Rutgers, as I explained, and we surveyed, or the numbers from the Netherlands Autism Register are based on 985 participants, and those of Rutgers on about 15,000 participants in the Netherlands. You see there is a difference between those two groups. In the Netherlands Autism Register are more people assigned female at birth compared to people assigned male at birth, compared to the general population. And what you can see at the right of this slide is that in the Netherlands Autism Register, or the people in the Netherlands Autism Register, but I think autistic people in a lot of surveys in the Western world, or more people report to be trans or gender diverse, or to identify as trans and gender diverse compared to the proportions in the general population. We already found that a few years ago and reported on that, and this is confirmed in an even larger group in the graphs you just saw. Another thing we've already described a few years ago was the larger variation relating to sexual attraction in autistic adults compared to peers in the general population. And that is also confirmed in the present survey. On your left, or on the left of the slides, you see the people who were assigned, no, who identify, again, I will make it easier to say that. And on the left of the slide, you see the data of the cis men, so people assigned male at birth and identifying as male, and on the right hand of the slide, you see the people assigned female at birth and identify as female, so cis female. And what you see is that in the group of autistic cis men, a little less identify or report to feel only attracted to people of the other sex, so to women. And on the right hand, you see that more, about half of the autistic cis female in the Netherlands Autism Register reports to not only feel attracted to men, but also to people of both genders or other. What we did for this study is merging the trans and gender diverse people into one group. We can discuss about that. I think there are all kinds of arguments, pro and con, but we did it this way for now. And there you see far more variation in the sexual attraction as reported by trans and gender diverse people, both the autistic ones and those in the general population. Okay, I just want to show you very quickly some numbers on the sexual experience of the cis men, women, and the trans and gender diverse adults in the group, and say something about how they report about how satisfied they are with their sex lives. So, the cis men in a general population, or the majority reports a variety of partnered sexual experiences. And if we ask the autistic participants whether they had ever experienced or ever done all these different sexual behaviors or had experience with them, then we see that a similar number of autistic adults or cis men report experience, although a little bit less than compared to the general population. We also asked about their experience in the past 6 months, and then you see that people in the general population, or that those numbers are a little bit lower. But if we compare the autistic, oh, that's the other way around. If we compare the experience in the past 6 months of the autistic people or adults compared to those in the general population, then we see that far more people in the general population report to have been sexually active with a partner compared to people with autism. We asked whether they were satisfied with it, and then you see that also that the people in the Netherlands Autism Register are less satisfied with the frequency and how they experience their desire and arousal compared to the general population. And when we asked to rate how satisfied they were with their sex lives in general, that the autistic people rated their sex lives lower compared to the general population. So although for the past 10 years, I stressed, or I have been telling or trying to tell and describe a positive story about sexuality, and I still do that, and I think it's important to talk in a positive way about sexuality. But what we see is that a lot of people have experience, probably less experience ever in their lifetime, but not in the past 6 months, and that people rate their lives or their sex lives lower. If you look at the females, we see, or the women, we see comparable numbers, and we also see comparable satisfaction. If we look at the trans and gender diverse people, we see that most of them reported to have partner sexual experience ever in their lives, but not recently. I have to hurry. I want to say one thing about sexual victimization, because I'm not going too deep in that, because a lot of people, we know that a lot of people, especially the females, report to have experienced sexual victimization throughout their lives, and we haven't looked at how that relates to the sexual satisfaction in general, but that's some of the things we'll have to do in the coming period. I already said that this is just one side of the story, and luckily we have a lot of qualitative studies that have been published over the past 10 years, and I think all those studies give an incredibly valuable insight in the experience and in autistic sexualities and in the role of sensory processing, in how communication plays a role in relationships, how stimming can have a function in sexuality, the diversity of experiences, but also how people deal with sexual norms and experiences, and how they deal with feeling that they do things in a different way, and how difficult it is to be open about that, how people experience difficulties to come out of the closet and feel that they have to live under double rainbows, that some people experience difficulties in finding a partner, and that a lot of people stress the need for more inclusive, comprehensive, and good quality information. Nymph, I'm going to go over my time. It was predictable. I think I want to point out a recent publication edited by Hanna Bertelsdorfer, Roskvist, and colleagues. They collected, I think, a really interesting number of chapters on sexual experiences of autistic adults and authors, who provide a really interesting insight in different kinds of autistic sexualities. I just wanted to show this one because an often recurring question I get, and an experience that is described by autistic people, is their interest in bondage and dominance, and so in BDSM. And so we took the opportunity to ask those questions in the survey we did in the NAR and in the general Dutch population. And the numbers we found show us that about 20% of the males and females in the NAR reported interest in BDSM, and a lower number in all kinds of different of what we call fetishistic interests, and that also some more autistic participants reported experiences with BDSM. That's no problem at all, please enjoy it. But I just wanted to show it because I think it's important to be aware of all these kinds of diverse ways of how people can enjoy their sexuality, and to see how we can pay attention to them in a way adapted to the age of people who work with in the sexuality education we provide. I'm going to go a little bit faster over these slides because Robin Michiels, who is in the audience, presented the results of a recent study we did on sexual assistance in Belgium. In Belgium and the Netherlands, we have a framework to offer a legal framework where we can offer sexual assistance to autistic people who don't have other ways to access partner sexual experiences. And the contact persons in the different organizations indicated or told us that they had the impression that they met a lot of autistic people in their daily work. So we set up an interview study or interview studies where we interviewed autistic adults who collaborated with sexual assistants and with sexual assistants to gain some insight in why people do apply for sexual assistance in the Netherlands or in Belgium. And they reported reasons that we find in other research on sexual assistance on people living with disabilities, specifically a desire for safe and intimate sexual relationships, gain experience, develop as a sexual being in a safe context, combined with lack of opportunities to gain those experiences in other situations. And I think we found, or if we look and analyzed at the transcripts of all the interviews, we saw how the autistic adults and the service or the sexual assistants described that the importance of building safe and supported interactions, and the importance and the time that it took to build these interactions. And then when the safety was established, then to go on explore sexual scripts. So we think that for a group of people who otherwise won't have access to partner sexuality, this can be a part of how we can guarantee or how we can realize sexual citizenship for autistic people who wouldn't have access to partnered experiences. But it has to be clear that this only can be done, I think, within a clear legal framework. And even then we met we found several ethical issues that should be thought about when organizing these kinds of services. So I just quickly want to show you or share with you the results of a project we did over the past few years in a, I think, really collaborative way with a lot of people in this audience, autistic advocates, autistic researchers, working in this field, and professionals on how we can promote sexual well-being in autistic young people and adults. We set up some discussions with a large group of people to define a set of recommendations that we later on checked with a larger group of autistic people and parents across different countries and continents. And we, in the end, we ended up with this set of recommendations in 3 groups, and you see that the column on the right is in cursive, and that's because our experts thought it would be important to create supportive communities and ways to meet each other, but that was not endorsed by our survey in a larger group of autistic people. So a first group was making sure that people receive accessible information and education, make sure that healthcare and sexuality-related healthcare is accessible, and make sure that you organize research and practices relating to sexuality and autism in a participatory way, focused on well-being, and with the need for additional attention to people with intersecting identities. And I quickly want to show you some examples of it. We have been working hard, also in a really collaborative way between representatives of autism-led and parent-led organizations in the Netherlands and Belgium, with experts and experts by experience. And we developed a website offering accessible information relating to sexuality, gender, and relationships, which is freely available in the Netherlands and in Belgium. But I thought with Google Translate, it's accessible for everyone, so I think I just show it. We also published the same information in a book, but please don't buy the book if you can read it online, because there it's free, but some people prefer the book. I think what I wanted to point out is that an experience that has been described by a lot of people the past few days also relates to sexuality. It's that the most recurring question we received when we reached out to people in the autistic community in the Netherlands, asking them what we should provide, on what teams we should provide information. One of the most recurring question we received is what I am experiencing, is what I am doing normal? And I think that's kind of the same experience that we hear over and over and over and over in the testimonies the past few days, like feeling different, feeling other, also in this way, different from other people. Also for the people living in the UK, or for people, the English-speaking people in the audience, there are some really interesting toolkits and information. There is information available. In the UK, you have the SAIL project, on which site you can find really valuable information and tools. So please check it out if you want more information. Despite that, the people who replied or who completed our survey on the recommendations said that meeting each other was or that they didn't endorse the importance of creating safe ways to meet each other. We set up, and Ilonka van der Somme, who is somewhere in the audience, took the initiative to set up a group of, or to bring together a group of gender diverse young people, autistic gender diverse young people, to meet and to develop with social designers ways that could help them to discuss their experiences and needs with the people around them. And I think these young people developed really interesting materials to discuss or to talk about their sexual questions, experiences and needs with people around them. But also when they developed these tools, we also saw the importance of bringing people together and exchanging their experiences, and that was also what several of the young people who participated reported. Let me skip this one because I'm totally running out of time. Is there need for further research? We set up a project during several weeks of special interest groups at the INSAR meetings, also with a lot of people in this audience, and a lot of groups of autistic people, asking them what information they still lacked and what we should research in the future. What we see there is that people stress the need for research that can contribute to their well-being, and that the research that we should do to contribute to that can only be done when we gain more insight in the sexual experiences and development of autistic people, especially in people, not only in people with who are scoring in the normal range of our intelligence tests, but also people with higher support needs, people scoring lower on intelligence tests. And so we are now conducting a study where we are interviewing adults on their sexual development throughout their lives. And in a first phase, we did that with people without intellectual development. And at the moment, we are doing similar interviews with autistic adults and an intellectual disability to see if we get more insight in their experiences. So what I wanted to say is that sexuality is part of our lives. I think that's clear, and that sexual well-being contributes to our general well-being, that we should pay attention to the experiences and needs of autistic adolescents, but that we don't have insight in all of these groups, and that we should pay more attention to them. There's a diversity in experiences and a diversity of barriers and needs, And I think that you can contribute to sexual justice by actively ask and listen as caregivers, professionals and scientists to the needs of the people you're working with or caring for or befriended with, that we can help by providing information, education, support and care. That all these information should be based on the experience of autistic people so that we acknowledge their experience, advocate for the rights of people and their sexual well-being, and that, as I said, there is attention needed to groups with intersex identities and people in vulnerable situations, because we still lack insight in their experiences. Thank you for your attention, and I wish you an interesting afternoon. No questions.
So, we won't have questions. Chairing is definitely a terrible job when you have to cut someone off speaking about their passion. But our huge thanks to Jeroen for delivering his talk today and bringing such an important topic to the forefront.